Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to go over how a bunch of light particles make electrochemical energy and end up as an image in our brain. So we've already established in our previous videos how photons are turned into electrochemical energy. Now this is a fancy way of just saying that the light particles that strike our retina are being turned into little messages that are whispered throughout our optic nerve and to our occipital lobe in our brain. But how do these messages reach our brain? What is the pathway that these little whisperings, that these little messages take so that we can have an image in our brain? Well, first we must know that our visual fields are what we can see. They're divided into 4 quadrants, and this can be kind of a confusing concept. It gets flipped around a lot, so we have to make this very clear. So on the far left, we have our left temporal field. It's what you're looking at right now. We have our left temporal field. In the middle left, we have our left nasal field. In the middle right, we have our right nasal field. And on the far right, we have our right temporal field. So these are 4 areas of our vision. Now, a part that is sometimes confusing for a lot of people, I know it was confusing for me when I first started reading it. Well, we also have to know that each retina is divided into 2 halves. So this means that each eye has one retina that is divided into 2 hemiretinas, or half retinas. So on the left side of the left eye, we have what is called the left temporal hemiretina. And in the left eye near the nose, we have our left nasal hemiretina. On the right side of the right eye, we have our right temporal hemiretina. And on the right eye and sort of near the nose, we have our right nasal hemiretina. So here's a kind of weird part that makes sense if you really think about it. So our eyes are circles, and because they're circles, it means that our retinas are just a little bit curved. So we can see that they're just a little bit curved. Well, this means that our retinas are not just flat pieces of paper that are pasted on the inside of our eyeballs. No, they're more like a boomerang shape. They're bent. So for this reason, the left temporal hemiretina will actually see our left nasal visual field. And conversely, or on the other hand, the opposite, the left nasal hemiretina actually sees our left temporal visual field. And on the right side, it's the exact same thing. So our right temporal hemiretina is actually responsible for our viewing, for our seeing of the right nasal visual field, and our right nasal hemiretina is responsible for our vision, or our viewing of the right temporal visual field. So another reason why the retinas are divided into halves is because each half forms its own sort of bundle. So this part is essential to understand if we're going to understand the pathway. So each hemiretina of the eye comes together to form an optic nerve for that eye. So you can see that this bundle right here is the left optic nerve. This is the right optic nerve. So for example, the left temporal and left nasal hemiretina form the left optic nerve. The same goes for the right. Now, this is the part that gets really interesting. The temporal hemiretinas for both the left and the right eye go on and connect to the same half of the brain called ipsilateral. So the left temporal hemiretina, shown here in green, travels all the way eventually to the left occipital lobe of the brain. And the right temporal hemiretina, as shown here in red, will actually travel eventually to the right occipital lobe. So this is what we expect. It's no big deal. It's exactly what you would think if you had never studied this before. However, the nasal hemiretinas actually cross at a place called the optic chiasm. So this is the important part. This is where a lot of people get confused. This means that the sensory information, the light information that we are receiving from our left nasal hemiretina, is actually going to travel across here, go to our right occipital lobe. And the sensory information from the right nasal hemiretina is traveling, it's going to cross right here to the left occipital lobe. So if you're interested in why this is the case, it's so important in our evolution as vertebrates to protect our spinal cord and to orient it the correct way and to develop further. Our nerves became decussated or crossed. So this is why it's called the somatic twist. So it's why some nerves in our body are crossed and feed to the other half of our brain. So the result is now that you're watching a video and you have to learn that the nasal hemiretinas cross at the optic chiasm. So what does this mean for us? Well, it means that the left optic nerve is the left temporal and left nasal hemiretina. That's the left optic nerve. And that the right optic nerve is the right temporal and right nasal hemiretina. So that is the right optic nerve. It's what we expect. But after the optic chiasm, these nerve bundles are called tracts. And because of the somatic twist that we talked about, our left optic tract is made up of our left temporal hemiretina and our right nasal hemiretina. Now, conversely, our right optic tract, shown here, is made up of our right temporal hemiretina and our left nasal hemiretina. So let's take this one step further. So the optic tracts both synapse on a place called the lateral geniculate nuclei. So these nuclei send the information through the left and right geniculocalcarine tracts to the occipital lobe in the brain, where they are interpreted as images. So in review, we have the optic nerves shown here. We have the optic nerves. We have the crossing at the optic chiasm. Remember, what is crossing? The nasal hemiretinas of both eyes. Next, we have the optic tracts shown here. We have the lateral geniculate nuclei, or left and right nucleus, right? And then we have, finally, these little dotted lines represent the geniculocalcarine tracts that lead to the occipital lobe, or the backmost lobe of our brain. So let's take a look at what various lesions or injuries look like so that we can use this pathway, we can develop our sense of an understanding of vision. So a good rule to follow is that whenever you spot a lesion or listen to an assessment from a patient, it's always a good idea to trace back from the lesion to the retina, or vice versa, so that you can see where the deficit is actually coming from. So to appreciate this, you can take a piece of paper or two pieces of paper and you can cover up your screen as an exercise while we learn this. So first, we're going to take our scalpel and we're going to cut the left optic nerve. So what did we just do? We just cut the left optic nerve. So what will the vision look like? Well, first, you have to tell me which part of the retina has been affected. We know that the left optic nerve is connected to the left temporal and the left nasal hemiretina. So the left nasal and the left temporal fields will be affected. I've drawn it color coordinated so you see exactly which parts of the visual field are affected. So we know that both the nasal, if we take our scalpel now and we cut the optic chiasm, what is going to be affected? So we know now that both of the nasal hemiretinae are going to be affected. So what is that going to look like? Well, we are going to lose both of our temporal fields of vision. So now let's cut the right optic tract. What happens when we cut the right optic tract? What's going to be affected? Well, we know that the right temporal hemiretina and the left nasal hemiretina are going to be affected. So this means that the right nasal field and the left temporal field will be affected. So now let us say that we've made a cut at the left geniculocalcarine tract. Well, what is going to be affected? Well, we know that the left temporal hemiretina will be affected. This will cause the left nasal field to be affected. And we also know that the right nasal hemiretina has also been affected. Well, this means that the right temporal field will be affected as well. Although, at this point, something very peculiar happens. Well, some of the nerve fibers of the macula, remember that center of sharp vision, do not directly use the geniculocalcarine tract. So, the very center of the visual field, the sharp vision, will be preserved. This is known as macular sparing. So all in all, I hope that you guys learned a little bit today about the optic pathways and how we take an image and it is transmitted to our occipital lobe. And as always, thank you for taking the time to learn with us today, and I hope that you like and subscribe for more content. Thank you.